Live.
Welcome to the COVID313 Coalition for Families and Students. My name is Christine Bell. I'm honored to serve as the Executive Director, proud member of this coalition, and really excited for today's town hall. I want to first say Happy Veterans Day and thank you to the people that have served our country. We honor you today, and we are really excited because we have a special guest today we're going to learn more about resources for veterans. Remember that this is a two-way conversation, and so we want to hear from you. You can chat your comments or questions on Facebook, and Lindsay and Brooke are there waiting to hear from you. Just to make sure that they are on their toes, why don't you tell us about how you heard about the town hall today? Also, we're translating the town hall to Spanish and ASL, so we want to take a few minutes and let people get on the right line and get comfortable. And I'd like to invite Cristina Guzman to share how you can listen to the Spanish interpretation. Cristina? Cristina, we can't hear you if you're talking. Why don't we come back to Cristina, and we have Julie back. Oh, Cristina, can we hear you?
Yes, I was having issues with my audio.
It would not be a town hall without some glitches. Cristina, go ahead and share the Spanish translation information.
Good afternoon, buenas tardes todos. La traducción en español va a estar en el Facebook de UNI o en el link que está en el chat. Por favor, hagan acceso para traducción en español. Gracias.
Cristina, we're so grateful to have you here today. With our audience, how they view the ASL interpretation. Thank you so much, Julie. Thank you, Julie. For our experts today, please remember to speak slowly for our translators. They want to make sure that they're translating the important information that you're sharing correctly. Also, turn your cameras off when you're not speaking to ensure that our ASL interpreter can be seen, and mute yourself when you're not speaking. We have Michael that's doing our timekeeping today. So keep an eye on your chat. He will chat you your remaining time. And if you go over, myself, Rajeshri, or Jameta, who are all moderating today's town hall, will come onto the screen and gently remind you to wrap it up. So to kick us off today, we are going to hear from Dr. Valbuena, and I will kick it over to Rajeshri to introduce him.
Thank you so much, Christine. Hello, everyone. Welcome back, Dr. Valbuena. We're always so happy to have you here with us and sharing your information and knowledge. So without any further ado, let's talk about boosters / third shots. First of all, can you please, for everyone's benefit, clarify who is eligible and what is the difference between a booster and a third shot?
Yes, good afternoon, everybody. Glad to be with you today. The difference between a booster and a third shot are the third shot we use that name for individuals who have received 2 other doses of the mRNA vaccines, the Pfizer or Moderna, and have an immune deficiency or immune compromised situation, which means that from the 2 doses, we believe they didn't get the maximum benefit of protection, and so they're getting a third dose. So that's a smaller population that we would say are getting a third dose. Everybody else is booster. So those are individuals who completed a series of Pfizer or Moderna, or received one of the Johnson & Johnson vaccines, and now are being given the recommendation to get an additional shot, which is considered a booster for them, to make sure that the defenses that their body has created from the completion of the first series, as it's dropping, that we catch it before it's too low so they don't catch COVID-19, and bring the immune system back up to the maximum protection from the COVID vaccines.
Great. So are the dosages the same in those two, or is there a slight difference?
Yeah, so there's a little bit of a difference. It's a half the dose than the initial ones for the boosters. It's not, from a patient perspective, it is, I guess, important to know what you're getting and how much you're getting of it. But that is what was seen to be most effective in getting the immune system to the level that it needs to be. And those are specific now for the following: anybody who's 65 years or older, anybody who's 18 years or older who lives in a long-term care setting, anybody who's 18 and older who has an underlying medical condition. Now, this doesn't have to be one of those immune suppressing conditions. It could be hypertension, it could be diabetes, could be asthma, any underlying medical condition. So many, many individuals who take medications on a regular basis for a condition would fall into that group. And then anybody who's 18 or older who works or lives in a high-risk setting. And I can tell you that most providers are not asking for medical documentation of fitting into one of these groups. Individuals come in, it's been at least 6 months since they completed their initial series with Pfizer or Moderna, or 2 months since they received their Johnson & Johnson, that we would verify, and we have a way to verify that on their card or in our Michigan registry, the Michigan Care Improvement Registry, and then administer their booster dose.
Okay. So what I'm hearing from you is there a criteria for who is eligible. The criteria is quite wide.
Yes.
And broad, and most providers are not asking for proof.
Correct.
So if we feel as though we need a booster shot, it's been 6 months or 2 months from the Johnson & Johnson, it's probably okay to go get a booster shot.
That is correct.
Okay.
That is correct. And that is over and above what we're doing from now the 5-year-olds to the 17-year-olds, which would be outside of this group, which we are in the heat of vaccinating. We received those vaccines and we've already started.
Great. So you mentioned, as we talk about the different, we've talked about the different types of vaccines, the Pfizer, the Moderna, the Johnson & Johnson. As far as a booster goes, does it matter which one you get? So I had the Moderna vaccine. Do I want to get the Moderna booster? Does it matter which one I get? Is it okay to mix and match?
You actually have that choice now. So the CDC says you can mix and match. So those who had the Johnson & Johnson would not be getting a booster of Johnson & Johnson. They would get Pfizer or Moderna. If you got your initial series with Moderna, you can elect Moderna or Pfizer. If you got your initial series with Pfizer, again, you can elect Pfizer or Moderna. So that choice is now available. What we've been doing at CHAS is trying to give you the booster dose of what you got in the first series of 2. But if someone comes in and says, I want the other one, we will gladly give them the other one.
Okay. What are reasons that people might not want the same one that they had before?
Just what they've heard about. Oh, I heard Pfizer's better. Oh, I heard Moderna's better. Or, in the first series, they might have had some added, local side effects for a day or two. And they said, well, let me give the other one a try because I know someone else who got the other one and didn't have any side effects, which there isn't. That's why we've given that ability, or the CDC has given that ability to pick which of the 2 boosters you want, because from a medical standpoint and from a protection standpoint in your immune system, they both will work regardless of what your first series was. So, we're not really asking for those that want the different one, the why, but I can tell you just from anecdotally from patients that I've interacted with that have said, they want the other one. Those are a few of the things.
Okay. So patient comfort, they feel like they've heard something, or being able to tolerate something different. That makes sense. I know we talked about waiting about 6 months for the Moderna and Pfizer and 2 months for Johnson & Johnson. What's the optimal time? Is it that 6-month mark? Could it ever be too late or too early to get the booster?
Yeah, so currently, I would say 6 months is the recommended time. Beyond 6 months would still be okay. What we're trying to do is catch the individual in the window of protection, let's say, that as the immune system protection starts to drop, we want to catch them in a certain window where it's still not too high of a protection, but then not too low of a protection. One, because if it's not low enough yet, you're not going to get a good effect from the booster. Or if it's too far, then you risk catching COVID-19. And for right now, the evidence that we have shows that right at about that 6-month mark is when the level should be dropping off enough that the booster is going to have the maximum effect. So we would say we don't want you to do it earlier than 6 months, because we know that most individuals still have that good protection, and the booster isn't going to really provide much benefit. But it can go beyond the 6 months if needed.
Okay, so it makes sense. Too early, and you're not going to get the boost from the booster, is what I'm hearing you say.
That's correct.
And it's never really too late, except you put yourself at greater risk of actually catching COVID-19 if you don't have enough of a immunity there.
Right,
okay.
Spot on. Yep.
That makes sense. All right. So doctor, I had COVID, as I shared with you a few months ago, and we're fine. Do I need to get a booster?
Yeah. So individuals who have had COVID, maybe once, maybe twice now, there is some protection that is created from that exposure to the virus, but it's not as good as the protection that you get from the vaccine. So even if you have had COVID, we are still recommending that you get the vaccine.
So I'm thinking about what you said about being too soon, right? So we have some response from actually having the virus if you've had COVID. How long after having COVID, if I get it, immediately, could I be in that category of too soon? Like, how long should I wait till after?
So the protection that you're going to get from actually getting COVID is pretty good. It's going to get you to a certain level, but that already is in that window where, for those that got the vaccine as they're coming down, would be warranted to get it. So that's why we're recommending that even though you get some protection, it's not high enough, and the booster the vaccine series will work to get you that extra protection that you need. So you are already in that window. The protection of getting the virus isn't as high to begin with.
Okay. All right. And even if you've had it multiple times, that's sort of the same thing. Okay.
That's correct. And one quick thing about that is individuals have been told in certain settings, if you've had COVID, from the time you're diagnosed, you got to wait 3 months before you get the vaccine. That's not the case. From the time you've had COVID, what we want is at least 2 weeks to go by, your symptoms to be almost all resolved. You may still have a little bit, but they're mild. At that point, you're ready to get the vaccine. So you have to wait 3 months.
Okay. Thank you for clarifying that, because I had heard 3 months, and all the dates and times, it gets a little confusing. So, all right, that's good to hear. As far as, now that we have boosters, right? Now that people have boosters, does that change the definition of fully vaccinated? In other words, are you still considered fully vaccinated if you have not yet had your booster?
Yes. Yeah. The fully vaccinated definition currently includes the 2 weeks after getting either the 2 doses of the Pfizer or Moderna, or the 1 dose of the Johnson & Johnson. And that definition hasn't been changed yet.
Okay. Hasn't been changed yet. Yeah. What happens to folks if they don't get the booster or the 3rd shot?
If individuals don't get the booster or the 3rd shot, they're at risk of catching COVID-19 and having negative outcomes.
Okay, so we basically are at risk of getting COVID-19.
That's correct.
Okay, that's helpful. Any risks that we should know about to the vaccine or booster?
Nothing more than we've talked about throughout the year when we started vaccinating. There isn't any new major side effect that has been, presented in the literature, and so nothing new to report in that space.
Okay. How have people responded to the booster? Has it been similar to what the response was to the original vaccine? Are there less side effects or impact, or how have people tolerated it?
Yeah, because the dose is a little bit lower. I think some of those local side effects that you get in the first 24 to 36 hours may be a little bit less. We're still ramping up in the booster space. So we've had a fair number, but not, I wouldn't say we're half of the way of everybody that got vaccinated. We're almost at 12,000. We're just shy of 12,000 doses given here at CHAS.
Wow.
And, a fair number of those now are obviously the first and second doses. We're getting the boosters in, but not a lot of change from the comments or the side effects that individuals had from the first series.
Okay. Is there anyone who shouldn't get a booster or a third shot?
I would say if you've gotten the first two and you haven't had major side effects that put you in the hospital with a tube in your throat to help you breathe, that the chances of you getting a major side effect with the booster or the third shot are minimal. So we haven't had anybody yet that we've told, don't get the booster, don't get the third shot. As long as you did well with the first two, the booster and third shot are recommended.
Okay, so no tube down your throat means you're good for the booster.
Yeah.
So pretty much,
everybody. Yeah.
Everybody.
Yeah.
And then, other than coming to you in this town hall, of course, where else can folks go to get credible information and research, and also that's written in a manner that like the non-physicians, the non-scientists of like me can actually understand?
I rely significantly on the CDC website. The CDC website is in many, many different languages. It is presented for the most part in a very easy to understand terminology with images and with charts and with graphs, so that people who learn better from seeing a visual cue than actually reading a paragraph can understand it better. I would say, and it also has references of where the information comes from that you can go to. So I would say, a hospital website, a CDC, NIH website, a major university website would be the places to go, but definitely not Facebook or Twitter or Instagram, unless it's one of those from the ones that I mentioned that happen to have an account in those, like CHAS does.
I think that's such an important thing to point out, right? Because even though people with the best of intentions, like we may share something, it's become so important that we really curate what we believe, right? And so my cousin may send something out that she believes to be true, but I agree with you, but it's not coming from a valid source, the CDC website or something of like what you described. Right. It's important that we not. That's where we should be getting our information right now.
Right. And I would also be remiss if I didn't mention, everybody should have an established relationship with a primary care provider. Yeah. And that is your go-to person, individual, to get answers to medical questions. That's what we went to school for. And ideally, you've created a relationship with that provider that allows you to reach out and ask these very, very important medical questions, and feel that the response is something that is true, that that is going to be in your best interest.
Yes, that makes complete sense, and having that relationship is just so important. So talk a little bit of, and I know we've talked about this before, but obviously there's more information now. The efficacy or the success rate, if you will, of the different vaccines. Is the Johnson & Johnson less effective than the others? Is that why we're not seeing Johnson & Johnson boosters?
Johnson & Johnson has not been approved yet to do the booster. So they have to apply. I think they may have already applied. They're waiting for the governmental agencies that need to review it to get it approved. I can tell you that all of the vaccines, with all of the data that we've accumulated since we started giving them, are still working very effectively, all of them, the Pfizer, the Moderna, and the Johnson & Johnson, to keep individuals out of the hospital and to keep individuals from having major consequences of contracting the virus, up to and including death.
I think that's an important point to reiterate, Dr. Valbuena, is that the vaccines and the boosters are designed to help us have less severe cases, less severe reactions, not allow us to be in the hospital. There is always a chance of us still catching
Correct.
COVID-19, but
Correct.
it's the how badly we have it, for lack of a better way of putting it.
Right.
It's like when we all got it, the vaccine did exactly what it was supposed to do. It protected us to a certain point. And once we became vulnerable, we may have caught COVID-19, but we did not have a severe case. We were not in the hospital and we were covered.
Correct.
So I think it's important that, we remember that that's what the vaccines are, not magic. The
Right.
vaccines are protection. And what we're doing is protecting ourselves.
That is correct. That's why we should still be wearing masks when we're in enclosed spaces with individuals that we don't know either their vaccine status or their COVID status. And I can tell you as of this morning, Michigan has the highest COVID case rate in the United States. So of the entire United States, we are at the highest COVID case rate currently.
And
so we still have a ways to go. Individuals are relaxing, they're getting their vaccine, their families getting the vaccine, they're getting the little ones vaccinated, and we're letting our guard down. And with the changing temperatures and the flu season upon us, we still have a ways to go. We're almost at 70% vaccination rate for 16 and older, which is good. But look, even with that, we're still the highest COVID case rate in the United States.
And your point about the weather, the sort of, our state having kind of a mixed reaction to this, like it all kind of comes together. One last question before I go to Christine, who I know has a bunch of questions from your loyal listeners, is about the flu shot itself. We talked about flu season. Flu shot at the same time as the booster. Is it recommended to do that? If possible, should you do them separately? What is your recommendation?
In the beginning, as we were learning about the COVID vaccine, we were asking individuals to receive and to give the COVID vaccine without any other vaccines at the same time. We now know that it is safe to receive the COVID vaccine and the flu vaccine at the same time. So for everybody that we're giving a COVID vaccine to, we're also offering at the same time the flu vaccine, because we still need that protection from the flu, because the season is now upon us. So they can both be given at the same time with no problem.
Great. Dr. Valbuena, thank you so much. I'm going to hand you off to Christine, who's got lots of questions for you as well, but it's always a pleasure to hear from you. And thank you for your hard work and for supporting the community.
Thank you so much. Glad I can be of help.
Thank you, Rajeshri. So, Dr. Valbuena, one of the questions from the audience is, some people I know are hesitant about getting the booster because they are worried that they will be depriving someone who hasn't gotten the vaccine yet. Are there enough vaccines to go around? Yes,
there are plenty of vaccines to go around. So as we work to get individuals vaccinated that have not been vaccinated yet, everybody that's eligible for a booster should be getting a booster. You will not be taking the vaccine away from somebody who has not started their series yet.
Great. And then my doctor told me I needed to wait at least 2 weeks between my flu shot and booster shot. Is this true? Is it necessary? And I know you just talked about this, but
So if you happen to have gotten the flu vaccine and didn't get your booster at that time, maybe it wasn't time for it yet, or they didn't have it, and you want to get the booster, there really is no issue with having to wait 2 weeks. Ideally, you want them both at the same time. We have them both, but I know some providers may have one and not the other. At this stage of the game, I think all of the flu vaccine providers in the state of Michigan, at least, have received their initial doses, so it shouldn't be an issue. So that 2 weeks time, I think the reason why the provider might have mentioned that is if there are side effects from the vaccines, that would allow them to say, oh yeah, that was the flu vaccine that gave you that, that irritation or chills or headache, and not the COVID vaccine. But at this point, there really isn't, the science now tells us we can give them both at the same time. So there really isn't have to be a waiting time in between them.
Great. And then as we talk about the boosters and the third shot, and we've talked a lot about COVID-19, but there's a number of different variants. Are the vaccines and boosters, third shots, as effective with the variants that we're starting to see?
With the current variants as of today, yes. There are new ones that are coming up, and those are being studied, but we don't have enough information for the most recent. The biggest one is the Delta variant that is the major variant in the United States now. And that's why we're anticipating that, similar to the way we get the flu vaccine, season to season, there'll be the top 3 or top 4 variants that are out in the community that will be in the vaccine that we get as our annual COVID vaccine series. But that's yet to come. We're still right now doing the boosters, and for right now, for the variants that we do have, they're working well.
Great. And I just have a follow-up question, because everybody may not know that the flu vaccine actually has a number of variants inside of it to protect you. So can you just explain the flu shot?
Yep. So that's every season, every year, what the manufacturers of the flu vaccine do is they study the different variants that are in the community, in the region, in the country, and now are putting the top 4 common flus into the flu vaccine. So when you get a flu vaccine right now, you're being protected against 4 flu variants. I know that the term variant, a lot of people have learned about that with COVID, but that's the same thing. So it's a slight variation of it, and we're being protected against 4. There are many more, but those are the most common ones. And so that's why, again, the vaccines are not 100% protective, but the goal is to get you protected against the 4 worst flus that you could catch during the season that could put you in the hospital.
Great. And also, so not to go to the scariest end of the spectrum, but really death. I mean, the vaccines have been effective towards keeping you out of the hospital and you dying. So
that is correct.
Okay. Well, Dr. Valbuena, we are so lucky to have you on our town hall. Thank you for making the time, as you've done many times before. We're very, very grateful. We know that you have lunch and patients to see, so we will set you free to have a minute to breathe and go get your lunch and go do your work, when we appreciate that work you do very, very much.
It's my pleasure. Thank you so much for inviting me. I hope to be back again soon.
Great. Thanks, Dr. Valbuena.
Bye, everybody.
Next up, we have Zaneta Adams, who is the director of the Michigan Veterans Affairs Agency. Zaneta, if you could turn on your camera's on. Welcome. We are so excited to have you today. As we all know, it's Veterans Day. It is a time to honor the folks that have served our country so bravely. And so, Zaneta, would you prefer that I call you Zaneta or Miss Adams? What's your preference? Oh, you're off mute, but we can't hear you. It's okay. I'm reading her lips, and she is saying sorry.
It's funny how we become good at that, huh, Christine, doing this, reading
Yes.
lips?
Can you hear
me?
Yes, we can hear you.
Okay,
Yes.
sorry. Not
Yes.
sure what happened there. So no, thank you very much. Zaneta works fine.
Okay.
But Zaneta works fine.
So Zaneta, can you share a little bit about your work and why it's important for you to do the work that you're doing?
Sure, absolutely. So I, first of all, want to say Happy Veterans Day to all the veterans out there. Thank you so much for your service and your sacrifice to this country. I have the distinct honor of serving under Governor Whitmer as the director of the Michigan Veterans Affairs Agency. I've been in this role since June of 2019, and really it is a passion of mine. I am a disabled veteran, a woman veteran. So I have many, I fit in many boxes where maybe I'm not seen as a veteran. And so it's my honor to be able to bring forth the resources and tools that our veterans in the state need in order to be successful. And we have the 11th largest veterans population in the country. And I believe it's the 7th largest woman veterans population in the country. So.
Wow. I did not know that. Well, thank you, Zaneta, for your service and your sacrifice. I did not know that we had that large of a population. Not surprising, because we have some really awesome women in this state about the women's statistic. So you just shared what the size of the veteran community is in the state, but what is the size of the veteran community in Detroit?
So for the state, we have close to 600,000 veterans in the state of Michigan. Of that, close to 600,000, a little over 84,000 live in Detroit alone. So that's a huge veteran population that definitely needs access to resources and benefits. And so we are consistently trying to make sure we're reaching that veteran population with the many resources and benefits that we have at our disposal.
That is a really large veterans population. And so what's the span of time in terms of, so I'm thinking about it in the sense of folks that have served in the different wars. What's that span?
So I don't have the breakdown for Detroit, but I can tell you that of that 600, close to 600,000, we have close to 200,000 veterans in our state that are 65 and older. So those are veterans who are dealing with Agent Orange, or Vietnam era veterans, Korean War veterans. We have some World War II veterans still in the state of Michigan. So we have a large, over a third of our population is older veterans. And so we have to make sure that we're reaching them in the way that's best for them. Not everybody's using social media. Not everybody, is, but just like on the other vein, not everybody's watching television or using a landline phone. So we have to be creative across all spans because we have a large diversity.
Wow. How has COVID impacted the veteran community in Detroit?
Well, and I saw Jametta Lilly here, I sit on the Racial Disparities Task Force for the state. And as many of you have heard probably over the course of these times, it has impacted veterans in general, but it has impacted a population that, you have predominantly minorities in the Detroit area, and that includes the minority population within the veteran population. And so you're already underutilizing resources and benefits. And then just like everything else, the VA kind of shut their doors to, things that were maybe just routine operations and all of those other things, and had to shift focus. And so then it was, let's go online, let's have these appointments online. But if everybody doesn't have access to internet, they don't have access to those resources to get connected to telehealth, then they actually suffered more tremendously than before. And so we saw that in the beginning. And so part of what we were doing was trying to reach out very virtually and in any way that we could at the MVAA to figure out how we can get them on the phone, how we can have other people reach us on behalf of them. And so we created some initiatives to help them as well. And we put more people out in the field, even if it was through social distancing, so that we can reach those populations.
Is there anything else that you want to share about how your agency or local agencies that you're affiliated with, what they created during the pandemic to make sure that veterans could be served?
Absolutely. So, our agency is the central coordinating hub for the state. So our job is to make it easier for you to get to where you need to be. So when you give us a call 24/7, our job is to make sure that we're asking you questions that you may call in about. Maybe you're experiencing, you're about to be homeless and you're experiencing that. Then our job is to make sure that we are not only asking you about that, but are you employed? Are you underemployed? How can we help you get connected to some of these other resources and benefits? And so out of that, we created this Check on My Vet initiative, where anyone who is looking to maybe check on a vet, and in not a mental health way or a social work way, but in a way to say, look, let's do a benefits checkup for you. So you could go on our website, fill out a form, quick form, and we can reach out to that veteran to say, hey, someone wants to reach out to you just to do a benefits checkup. And, if you're interested, we can run through that to see what you're eligible for, or, have you talk to one of our veteran service officers to see what you're eligible for in those areas. And so we did that. We did a huge media campaign. There were billboards, commercials, there was everything out there, and postcards so that we could reach more veterans, and it worked. Because of that, for the first time in over 11 years, we actually increased our veteran population. Not that we had all of these veterans moving to Michigan, but we had more veterans who lived in Michigan who now are identifying as veterans. So, the efforts are working.
So can you share a little bit more about what your agency does and the benefits that are currently available for veterans right now?
So our agency, again, we're a connector. So we know that you may have several different resources in your community, and maybe you don't know which one to turn to first. So give us a call and we can get you connected to all of those resources in your community and take the headache out of that. We provide access to a veteran service officer to help you get connected to your compensation and pension disability benefits. Many people go that path alone. They get frustrated, they give up. Give us a call, let us do the frustration for you and take the weight off of you. We provide emergency assistance. So for those who qualify, wartime era veterans, there are some programs for peacetime era veterans as well. We provide emergency grants. So we've had people that, their water wells have went out, or they had an incident that was an emergency out of their control, and we were able to help them to the tune of thousands of dollars. So we can help you out of those emergent situations. We also created during the pandemic a Food for Vets program where we had our individuals out in the community talking to veterans and providing them on the spot with food cards, because we knew that everybody was going to food pantries. And so we didn't want our veterans to have to go to a food pantry and then wait and get nothing. So we wanted to make sure that we met that need, and we partnered with the trust fund to do that. And so, we have some of those resources. We have in our state, we have license reciprocity. So if you had a license in the military, it's still good, or maybe you moved from another state and it's still good, you can actually get that license renewed here for no cost. You can get continuing education credits, and some of those are no cost and a quick turnaround, and your spouse and dependents can get that too. So we want to keep people in Michigan. We want people to move to Michigan, and we want to let people know that, this is a great place for you to live.
So for folks that may not know, so you said a lot of what you do, but the benefits that caregivers and children can get. Can you talk a little bit more about what some of those benefits are? And Zaneta, what's a license?
Right.
Yeah.
Right. So a license, when I mentioned license, and then I'll kind of go back to the other part of the question is, if you had a CDL, or you had an occupational, maybe you're a dental hygienist, maybe that was what your job was in the military, and maybe you just got off of, were no longer a National Guard member, and you're looking to see how you can utilize that in the state of Michigan. Those are the opportunities that are there to entice you to continue using that profession from the military. For caregivers, we actually became a Hidden Heroes state 2 years ago, and or almost 2 years ago. And it's really great because caregivers are people's spouses, friends, family that are taking care of veterans. And they don't call themselves caregivers. They just call themselves a spouse or a friend. But there are benefits, financial, mental health benefits that could be available to you from the VA for your caregiving, for the work that you're doing. And so if you want to give us a call at 1-800-MISHVET, we can help you get connected to those resources and benefits. And so for children of veterans, and we know children are taking care of veterans as well, that benefit is available to those who qualify. The other piece is that we have school benefits. So if you're 100% disabled, you have the tax exemption in the state of Michigan, where you're 100% disabled, you don't have to pay your property taxes. So that's something you apply with your county on. And then if you're 100% disabled, your children under, I think at the age of 26, can get access to money to go to school here in the state of Michigan as well. So there are a wealth of resources out there, and there's probably there are too many to name, really, but we can actually do that benefits checkup based on your individual needs and your individual questions at the MBA.
So sort of, you mentioned, you said airtime, I think you said airtime, peace, and then wartime benefits. So so two questions. What's the baseline eligibility for some of the benefits that you've talked about? And then could you get into maybe some of the nuances of what it means if you're a veteran during, I'm assuming what that meant is you're a veteran during wartime or peacetime. So if you could talk a little bit more about that.
Right. So, the beauty of it and the complexity of it is that there's no one veteran that's the same as another. So, but for the purposes of the state of Michigan, if you've served, put on the uniform, and you were not dishonorably discharged, then you're considered a veteran in the state of Michigan. So you can take your DD-214 and get the veteran designation on your driver's license. And that opens you up to, benefits and, discounts and things within the state that, you show your veteran ID, even today, right? With the free meals, that's on your ID. So you don't have to pull out anything else. It starts to get more complex, in the VA it depends on who's doing the assessment of a veteran, right? There are so many different veteran designations and definitions. So if you're looking to get federal VA benefits, there are several different criteria. You have to have served 180 days on active duty, or potentially, if you're looking for a pension, you have to have served, but there's certain other criteria with that. So there are many different nuances, and that's why we don't want you to navigate it by yourself. You want us to call us. We can actually get you your DD-214. Sometimes we can get it to you within an hour. Sometimes it may take, a few days, just depending on if we have it in our and access to it or not. And so if you're missing your DD-214, you've lost it, you're looking for it, maybe a loved one passed away and you were the next of kin, we can get that DD-214 for you and help you start getting connected to everything that you've earned. And so, that's a more of a complex question. We talk about wartime and peacetime. Wartime era veterans, we're still in a Gulf War era. So anybody that served since the start of Gulf War is part of a wartime era. There are some pockets of between the Korean War and the Gulf War, and that there are some veterans who served, but they didn't serve during a wartime. So it doesn't mean that you had to serve in combat or overseas. It just means that on your designation, it was during a wartime status. So
this is so interesting. So it sounds like the DD-14, did I get that right?
DD-214, yeah.
DD-2, I want to say it right. DD-214, that's baseline, and your agency can help veterans, but also next of kin, caregivers, access, and that is the start to understanding what other benefits you might be eligible for. Did I understand that correctly?
That's correct. And I would say that if you have your DD-214 or you need us to get your DD-214 for you, first of all, it's free. But second, I would recommend that, that we can send it to, can you hear me?
We can hear you. We can't see you now, but that's okay. Go ahead.
That you can send it to your county, because you want to be able to have a record and register it with your county so that if you lose your copy, then you can go right to your county and get it. You can always give us a call and get it, but sometimes it's easier to get it in your own county.
Great. And can you talk a little bit about what some of the myths and facts about, what are some of the myths and facts that we should know about veterans?
Myths and facts. So I would say too many veterans believe that they aren't truly veterans because they didn't serve in combat or because they're a woman. I think that's one of the facts that I've learned over the course of time. I talk to people who've served 20 years in the National Guard and they get out and they're like, well, I'm not a veteran. Well, by the state of Michigan standards, you are. And so we want to embrace you and wrap our arms around you. I think some of the other things are, women who've served in the military who have maybe felt marginalized, or maybe they were victims of military sexual trauma. They come out and you don't even know that they're veterans. And so part of what we've been doing is trying to educate women on the benefits and resources that are available. And we started this She is a Veteran campaign to highlight women veterans and to share these
Oh, Zaneta, we can't hear you now.
services.
There you go. Now we can hear you.
Yeah, across different ages and services. And so we tried to elevate women veterans and do the She is a Veteran initiative. So, you know, we serve all veterans. We've been really trying to highlight women veterans, LGBTQ veteran issues, and even tribal veteran issues, and also working to make sure that peacetime era veterans are getting connected to resources as well, because that's important.
Your sound has gone out again.
Oh, that's okay. I'm hold on one second. I'm
It's
sorry.
there. It's okay.
It's technology. It's raining out here, so I apologize. It's like a storm.
Oh no. It's amazing what creates bad internet service. So I think we've learned it. I'm always surprised. I don't know why, but I still get surprised a little bit when we've got technology issues. Do you want to try to talk to see if we can? Oh, there we go.
There you go.
Oh, you might want to, why don't you get off your computer?
I'm trying.
Oh, okay.
There we go. Is that better? I am so sorry.
Perfect.
Yeah.
No, it's great. Thank you.
All right.
So you were talking about myths and facts. And so if you want to start, you were talking about working through some of the LGBTQ plus issues and tribal issues.
Yes. And so, you know, we created this She is a Veteran initiative to highlight women veterans. And, you know, we had millions of views with our 6 women that we highlighted from across different backgrounds, ages, services, branches. And we were able to get a lot of women who reached out to get connected to their benefits and resources, who saw their stories within the stories that we released over the course of a year. And so we have a traveling banner campaign with these 6 individuals across the state to highlight women veterans, because we want women veterans to recognize that they're veterans too. And so we are doing that initiative. We're working with homeless veterans, even incarcerated veterans, and initiatives around that, so that when they come back out of when they return to the society, that they actually are prepared and have great resources and remember that military pride, so they can continue to move forward, and working with tribal veterans as well. So, you know, we have a lot of work to do. We have a large veteran population, but we're trying to make sure that we're leaving no one behind. And that includes our peacetime era veterans, because we don't want any veteran to feel that they're alone, because you know, for anybody that's listening, you're not alone. And I always tell people that it's okay to not be okay, but it's not okay to keep it to yourself.
I think that's great advice. How can civilians support veterans right now? Can we support veterans right now? And what are some of your suggestions for us?
Absolutely. So one of the things that we launched, and just to kind of get into really quickly, the suicide prevention efforts. So the governor accepted the Governor's Suicide Prevention Challenge that SAMHSA and the Department of Veterans Affairs asked us to take. And so we're the agency lead on that. And you know, one of our initiatives is asking the question, because we know that when veterans are connected to resources and benefits, their rates of suicide and suicidal ideations go down. And so when we talk about asking the question, we're not talking about, are you suicidal? We're talking about, have you or your family member served in the military? And it's critical that we ask it in that way, because not everyone is identifying as a veteran, but they all have identified that they've served in the military. And so we ask that question, and then we can get them connected to tools and resources that we have. And so we've been training hospital systems, banks, real estate agents, you name it, whoever wants to take part in our Michigan Veteran Connector initiative. We've been giving them training, their case managers, their tellers, training on what resources we provide. We give them a toolkit that has a sticker, QR codes, posters, all of that, they can be hands off with it. All they have to do is initiate with asking the question of their population, and people are starting to get connected to the resources and benefits that they need. And so that is how civilians can help. They can get on board with the Michigan Veteran Connector Initiative. There's no cost to them. And they can start not only asking that question, but helping them connect those veterans to us so that we can help them.
Zaneta, what a great way for us to get involved. So reach out to the agency if you are a place that wants to participate. Say the name of the program again.
It's the Michigan Veteran Connector, and you can just call that 1-800-MICHVET hotline and you can get connected to it.
Great. We have a question from the audience. Oh, and we've got a slide that shows it. So while that slide is up, we have a question from the audience, and this will be our last question today for you, is, in the director's opinion, what are some ways we need to improve services and resources available for veterans?
I think it's what I said. It's asking that question, and it's asking it in the right way, because again, we don't expect you all to have all the answers. We don't expect you to know all of the resources, but let us be that connector for you. And what it also does is, you never know when that veteran is coming in and they may be struggling with something. They may be feeling alone. They're isolated sometimes. And you just asking them, have they served, acknowledges that service, and it instills this pride that they remember that service. And so, just asking that question is a step in the right direction. Connecting them to the resource is the next step. So I think that's a big piece of what you can do. And just reach out to us. We can provide you training. You can become a veteran-friendly employer, which also is on our website. You can check that out. And we can give you all the tools you need to be successful there.
And then I think one part of that question was also around the current services that the VA is providing and that others are providing. Do you have any thoughts about how we might improve those?
So, continue to talk to your congressmen and women and your senators. We are consistently trying to bring new programs, pilots, more money from the federal VA side to Michigan to improve those services. I'm consistently advocating on that federal level to say, hey, how can we improve here or there? But it takes a village. So the more that we can talk to those congressional delegation members, the more we can potentially get things done.
So it just in summary, it sounds like we know there needs to be improvement to the benefits and resources, and it takes all of us saying our veterans are important and they deserve these benefits and services as they end their service, during their service, and end their service until they as they retire out, that they deserve these benefits and resources. Okay, well, Zaneta, thank you so much for being with us today. It's been such a pleasure to interview you, and also just to learn more about the veteran population in Michigan. I feel like I learned a lot. I did not know that we had such a large veteran population. So thank you. You've also given me a next step. I took a picture of the slide, and you'll be hearing from our organization so that we can make sure that we're able to connect the veterans that live in the neighborhood that our organization is in. So thank you so much.
Thank you, me, and sorry about the technical difficulties.
It happens. It happens. That's the life we live right now. So thank you so much, Zaneta. I'm going to kick it to Jametta, who's going to introduce our next person. Thank you.
And thank you, Zaneta. As the grateful daughter and wife and daughter-in-law of veterans, I am really so excited that you are in the leadership position that you are at the state. And so we're going to kind of move to the other end of the age spectrum and talk about something that we know so many families have the critical need for, and that's to understand the opportunities that are available through the child tax credit. And really tickled to be able to welcome to the program our colleague and friend, and one always that is advertising and advocating for kids and families, and that's Amanda Holloway from Congress of Communities. Amanda, how are you, and welcome.
I'm all right. Thanks so much, Jametta. It's nice to see you.
Nice seeing you as well. So what is going on, and how can we break this down for families to understand that this opportunity is available for many of us across a lot of different income groups? Some people just don't know. Let me hand it to you.
All right, sounds good. I sent in a presentation earlier that has some visuals for people who are more of a visual person. So the child tax credit is a stimulus for families that have children 0 to 17. Can we go to the next? There's a lot of people doing this outreach. It is definitely not just me, but I am Amanda Holliday, and I'm the Director of Early Childhood at Congress of Communities. But there are a lot of people doing this outreach work because this is a federal tax. And so every state, every person who has children 0 to 17, we want to get this information out to them. Go ahead. So it's a stimulus benefit. A lot of people think about it as being like the normal tax credit that you get at the end of the year. But this is actually available even for people who don't normally file taxes or have earned income. So for example, if you are a parent that's on SSI for disability or some reason like that, you can actually get this tax benefit. But it's not automatic, but we'll talk about that in a minute. You do need to apply. Can you go to the next? It is automatic if you filled out your taxes, I should say that. So this is a tax benefit for families, children is ages 0 to 17. And as you can see here, children under the age of 6 can get up to $33,600, and children ages 6 to 17 get $3,000. And the different thing this year is they're actually giving these this money in advance. And so the money is going to the families it started in July. And so if you filed your 2020 taxes, you should have been getting payments for the children that you filed on your 2020 taxes. And then the other half of the payment, after those advance payments, the other half will come after you file your 2021 taxes next spring. You can go to the next. So who's eligible for this? Again, it is almost anyone with children 0 to 17. That includes families who perhaps the parent does not have a Social Security number, but the children are citizens and have a Social Security number. The parents can apply for this under an ITIN number. It's also available to families with low or untaxed income, such as SSI or other things like that. It's any kinds of parents, as long as they're claiming these children on their taxes. So that could be a biological parent, grandparents, uncles, aunts, foster parents, as long as the children live with them at least 6 months of the year and live with them. And then you can see at the bottom the income limits. So for a single family household, the income limit to get this benefit is $75,000 a year. And for a married family, it's $150,000, and you can see head of household is $112,000. You can go to the next. So there's just one thing you got to do. You got to file your taxes. Now, many of us already did file our taxes, and so we are automatically getting that because if you file your taxes with the direct deposit option, the country already has your information, and so they've been able to just automatically send you that information. If that's not happening and you did file your taxes and you did have children on your taxes and you're not getting this money, then you definitely want to reach out to some of the people we're going to tell you about in a minute here. Go ahead. Yeah. So you have to file your taxes in 2020. And then to get the second half, you need to file your taxes in 2021. Here's the nice thing. If you file your taxes in 2021, but you haven't gotten any of the prepayments, you will get the full benefit after you file your taxes in 2021. So if a family has missed out, because I know it's November, right? So if a family has missed out on some of those advance payments, they do not need to worry. They will get the full benefit as long as in the spring of 2022, after 2021 is over, they file their taxes, they will be able to get the full benefit back. You can go to the next. So what I wanted to talk to you guys about is there are a lot of free options to get your taxes done in the city of Detroit that are supporting Detroit residents, and some Wayne County residents. So I really want to get this information out there that you can get free tax help. So you don't need to go to an H&R Block or another tax place where they're going to charge you money to do your taxes. You can get this for free. And these are some of the locations: Accounting Aid Society and Wayne Metro. And you can get all of this information and more if you go to www.getthethaxfacts.org. And also on the getthethaxfacts.org, United Way has offered a free guided online software for anyone to use, no matter what their income is. And then those families making $57,000 or less, they can go with one of those other two.
Amanda, I think my timing was perfect when I just said your name. That's the last slide. We have slammed up against the end of the program for today, and want to thank you so much. I know that we have this information in the chat, and I am hoping, Deja and team, that we have this. We have just about 1 minute, and Deja, if you would put up the other slides, we want our families to be able to see this information as well. You heard during the program that the criteria for booster shots was identified. We have in the chat for you information where you can go. The other thing we want to let you know is that the Detroit Public TV and the American Black Journal is doing a really important program coming up soon to look at the American Rescue Plan. So what are the implications of this historic amount of dollars coming into the community? So please take a look at that and tune into Detroit Black Journal. Also, you can see here our children, our babies are now eligible, literally, not quite our babies, but our 5-year-olds and older. Please make sure that you're getting the information, the education, and on this slide, you can see where to go. Next slide. We also want to make sure that for those of you who are listening, you're understanding that there's the COVID vaccine, that there is a third shot, and that is for folks who have a higher level of chronic disease and their immune system simply need more. There are also now boosters available for people that are 65 and older who are already vaccinated, but that booster helps to insulate you more, because we know, unfortunately, the variants are continuing, and until we have more of us who have the immunity and vaccinations, we are all at risk. So please take a look at this booster shot. We have 2 more slides that we want to share with you, and that is obviously you heard the great information about the child tax credit. Please make sure you're taking advantage of that. That is an opportunity available for all of you. Speaking about opportunities for children from 5 to 11 years old, join the Detroit Parent Network and the Detroit Health Department. Tomorrow, we are doing a Healthy Families Town Hall. We have young people who are going to be asking questions of top docs. We will hear from the Chief Medical Officer, from the Detroit Public School District, from the City of Detroit, and one of our major clinics. Please make sure that you register and are part of a great conversation between children, parents, and doctors talking vaccines. And last but not least, everything that we do also has to be focused on building up our understanding of equity and policy. And we're very pleased, Detroit Parent Network, to welcome Lieutenant Governor Gilchrist, who will come and talk about the ways in which the state of Michigan is moving equity to make sure that all of our families can thrive. The very last slide is one that you can take advantage of. Some people have been saying, well, where do I go for vaccinations? Where do I go for testing? We're providing that. At the same time, we're letting you know that there are people who are coming to you. So in addition to the Detroit Health Department, we're so excited always to be a part of Wayne Health, who has mobile units that are providing not only vaccine testing as well as the vaccinations, but screening, whether you have diabetes, heart disease, etc. Because remember, families, being healthy is something that we need not only through the pandemic, but afterwards and ongoing for the health and wellness of our community. So speaking of health and wellness, all right, COVID313 team, please come on screen. As everyone knows, or you should know, that we are a collective. We all work together. As you already know, we've got awesome moderators. We've got folks in the background with their headphones on and putting together slides. And we have awesome, trusted resources, experts like Zaneta that you heard today, Dr. Valbuena, you heard Amanda talking about tax credits. We're here for your community.